Jill has always been very interested in whatever she's doing. She could be just as bad as any other child or just as good. But once she got to college, she seemed to find her way. She was in exercise physiology, and she came home one weekend and said, "I'm really not interested in doing this anymore." And I said, "So why don't you take what you've learned and become a doctor?" And it was like watching a light bulb go on. You may have heard this before, I don't know. But anyway, she's like, "Great, I think I'll be a heart surgeon." And Mom said, "You're the first of 3 daughters. I don't think a heart surgeon's going to make it this time." So she looked around and she started thinking about chiropractic, the idea being fixing people before they got to the point they needed a heart surgeon. We checked out 2 schools. The first one she checked out was boring. The second one got her interest. And from the time she entered that, she was like sold. I think she would still be in school if she was allowed to. She loves to learn that much. She constantly strives to be better all the time. I just hope one of these days she doesn't burn out, because she tries so hard to be the kind of doctor that everybody needs. But she's a wonderful person as well as a wonderful doctor, and we're very proud to have her. Mom and Dad have been patients since 1991 when she graduated from school. She has been in different offices, but we've always been where she is, and we're very grateful for it, because every office has offered something new to her learning capabilities, and she has gone with the flow and learned a great deal more than what she just learned in chiropractic school. After I had endometrial cancer, I developed neuropathy in my feet and in my hands. And one weekend she came home and she said, "Mom, we've just learned how to deal with your neuropathy." And from that point on, she started working with it, and it made a huge difference in my feet and in my hands. Even now, I'm still using the equipment that she gave me from time to time at home, and it continues to do what it's supposed to do. They don't even have to ask me. We frequently tell people without even being asked, but when people do ask, we're usually very honest about it and say exactly what Jill says. If we can't help you, we'll find somebody who can. But she usually has been able to handle most everything that's come along her way, and if she can't, she's motivated to find an answer to it. I have spoken to more than one person about that when they talk about going to see a chiropractor because they've never, and I hear people talk to the effect, but chiropractors snap people's necks and they cause problems. And I'm like, have you ever been in a hospital where there wasn't somebody who made a mistake? It's not a chiropractic thing. It's a human thing that happens. And so I try to make them understand. There was recently an article in the paper about a doctor who had, a medical person, I don't know if it was a doctor or a nurse, who was attempting to help with a newborn baby and ended up killing the baby with the wrong dosage of medicine. That's one thing I don't have to worry about with Jill. She does not diagnose with medicine or with surgery, so I'm grateful for that. I'm grateful that people aren't breaking into her office for drugs or anything like that. Oh yes, I was excited about the gym when they opened it, and I haven't gotten over there nearly as much as I wanted to, because I'm here 3 times a week and I'm exercising 3 times a week in the water. Unfortunately, the gym doesn't have a pool, so I'm exercising in the water and then coming over here for my appointments. So I've been to the gym, and they have several pieces of equipment that I can use and that I have used beneficially. One of the other doctors has shown me 3 different pieces of equipment that were very helpful to me. Considering how many years I've been working with this, I would say totally changed my life. It really has, because before I didn't pay as much attention to my body as I do now, and that's a huge difference. I am paying more attention to my body. We didn't mention it before, but during the time that Jill was in school, I also became a simulated patient at the school. And it was eye-opening to know what these kids have to learn before they can become doctors. Actually, I think closeness of family makes a huge difference. I mean, you don't want to be a nag and you don't want to be a detective watching for them all the time. But at the same time, as I told you before, Jill had her days. When she first learned to drive, I would sit by the window and wait. At 10 o'clock, she was not in the door. 5 after 10, she'll be in the door. But you have to, whether you want to or not, you have to give them direction and hold to the direction. They have to work with patients before they're ever allowed out to work, like She worked at the Sheltering Arms Hospital for a while, and she also worked with other clinics before she was able to get her degree. So it was quite an experience, it really was. I have referred any number of patients to the Wellness Center. I have friends who will come from Arlington Heights this far out in order to see her, and some who see her on a regular basis, some who see her on what they call a need-to basis. But most of these patients have come for the full term and then gone into maintenance to be able to stay with the program. They've been very pleased. They were amazed. One gal that I had worked with was absolutely astounded when she could ride from here to Wisconsin without back pain after she'd seen Dr. Howe. And another patient was talking about having such problems with her knees after surgery, and she was amazed at the difference that it made for her to come here and have treatment. Oh, long-term makes huge sense, yes, because if you don't know what's causing the problem, you can't correct it. And that's one thing that they do, is to find out what it's causing the problem. Our youngest daughter was friends with two other girls through church, and they got into a great deal of trouble. And thank goodness Jennifer did not. But it happens to people, and it's not one person's fault. It just is that person's makeup, personality, whatever, that takes them in that direction. And if you can't curb it, then that's the danger, unfortunately. I think the key to Jill's success is her passion for her livelihood, her being a chiropractor, her being a person who can help other people. I would thank her for making the choices she's made in her life, especially the ones she's made to be a chiropractor. I'm very proud of our daughter. Both my husband and I are very proud of our daughter. She has been a godsend in more than one ways, and I couldn't be any happier than she's chosen this profession.